Sergio Raposeiras Roubin and Mike Gibson coming to you live from ACC 2025. We're talking about the use of Dapagliflozin in people with TAVR. Tell us a little bit about what you did, Sergio, and what you found.
We randomize patients after TAVI to dapagliflozin or not dapagliflozin. And it is important because clinical trials with SGLT2 inhibitors systematically excluded patients with valvular heart disease or undergoing valvular intervention. So we have not evidence in this context. And moreover, patients undergoing TAVI tend to be older, and patients over 80 years usually are underrepresented in clinical trials with SGLT2 inhibitors. So I think that our study have a lot of information in these new scenarios.
And what did you find?
We find that dapagliflozin was associated with an important reduction in the composite endpoint of all-cause death and worsening HF. And it was driven mainly for worsening HF. For all-cause death, there was not significant difference, but for worsening HF, that was defined as hospitalization by HF and urgent visit for HF. There was an important reduction. This was a 37% reduction in this endpoint.
So, do you feel this changes practice? Is this enough evidence to change practice? Should we be using DAPA in our TAVR patients?
It is very important because we have not evidence in those patients. Sometimes we use in clinical practice, but there is not evidence to use in this scenario. And it is also very important because we also show safety of these drugs in this population, that is elderly population. So I think that is a new step in this clinical scenario to use these drugs.
Great. Well, thank you for sharing with us. Thank you for joining us. And thanks to all of you for joining us here live from ACC 2025. Thank you, Sergio.
Thank you to you.